HealthTech listeners, I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice across health and social care. Today I'm welcoming not one but two guests to the podcast. We've got Sophie Randall, Director at the Patient Information Forum, and we've got Julie Smith, who is Content Director at EIDO Healthcare. We're diving into something that affects every patient interaction but often goes unnoticed: trustworthy health information. We're talking about the PIF TICK, the UK's only quality mark for reliable, accessible and evidence-based health content. With misinformation on the rise, the PIF TICK plays a vital role in helping patients make informed decisions, especially when it comes to giving consent. We'll also hear how organisations like EIDO Healthcare, a gold standard in patient information and digital consent, are using the PIF TICK to raise the bar for clarity, accuracy and trust in healthcare communication. Sophie, Julie, welcome to What the HealthTech.
Thank you.
So let's start with a little bit about the Patient Information Forum. So for our listeners, we're going to refer to this as PIF throughout the episode. Sophie, can you tell us a little bit more about this and what it's all about?
Yeah, PIF is a membership organisation effectively for people working in health information. What makes us slightly unusual is that we cover all sectors. So it's a real community of practice where we bring best practice together from all sectors. So we have organisations like EIDO from the private sector, a host of national health charities, NHS organisations, royal colleges, academics. Anybody who produces health information can join PIF, share their best practice, and we learn from each other. We've been running for almost 30 years. We're a charity. And our vision is everyone has access to health information that they can trust to make decisions about their health and care. And it's that everyone in the vision that's so important because it can be really difficult to access trusted health information. To support that vision, we now set standards for health information, and they go beyond the old standards of kind of credibility, evidence-based, but we really put an emphasis on information that people can use and understand. So we launched the PIF TICK in 2020, and that is the Trusted Information Creator certification. And we did that because we were really concerned about the rise of misinformation. There's now 150 organisations that are certified under that scheme, and EIDO were one of the first private sector members to join. And we're really pleased to have Julie on the steering committee that helps us set the standards and keep those criteria under review.
Julie, do you want to touch a little bit on, obviously, EIDO's involvement with the PIF TICK? Obviously, Sophie mentioned it was 2020 when that was launched, so it's now, celebrating its 5th year, and why it's so important within healthcare today.
Yeah, absolutely. So from my perspective, it was all very perfectly timed. I joined EIDO towards the end of 2019, and we started speaking to PIF fairly early on after I'd come on board at EIDO. They explained the PIF TICK to me, and for me, it kind of made perfect sense for us to be involved. And also, when I joined, one of the things that EIDO wanted me to do was to really establish those processes and policies around how we produce our patient information. So actually, the PIF TICK criteria was somewhat of a manual for me. So all the information had been created, over many years to very high standards, but actually having those policies really clearly written and shareable so we could show our users that we are maintaining a really high standard was useful, really great timing. And for the past 5 years, it's just been a fantastic, really rewarding and useful relationship for us. And we've learned so much. We've added and improved to our processes as a result of having the PIF TICK and having that accountability. And like Sophie said, being on the steering group as well. So being able to be on the other side of it and seeing how that criteria has been growing and how it's evolved, as Sophie said, with misinformation, and I'm sure we'll touch on AI and all those big changes that have happened in the last 5 years. I've really loved being involved in it, and I know that we've done a great amount of work on our offering as a result.
And how do you, at EIDO Healthcare, integrate that PIF TICK into the consent documentation and all the patient education materials that you produce?
So the way the PIF TICK works is that PIF review our processes using their criteria annually. And it is a very thought through process. There's lots of steps that we have to follow, but now that we've done it for 5 years, we're very familiar with it and comfortable with it. But it means that we are being held accountable to, obviously we're always held accountable to patients and to customers and to clinicians, and being in the medico-legal space, that is really important. But actually having someone say, that's great, but show me the evidence that you are following all those steps, has been really important. And that's how we've integrated it. We do things now, like in our monthly meetings, we always discuss the process. So one of the things that Dan Wills really emphasised, and he's sort of heads up PIF TICK, he's normally our assessor, is, are you reviewing how you produce that information, or are you just doing the same thing over and over again, regardless of any changes that might be happening in that kind of wider healthcare space? So we found that really helpful. And other small things that he's given us tips about. So for example, everyone will get some negative or constructive feedback, and that's great, and we always work on that. But he also said, but what about the positive feedback? What do you do when you get that? And I sort of, when he said that to me, I was like, oh, nothing really. We just say, yeah, great, well done us, and then move on to the next thing. But actually encouraging us to review that and see how that has positively improved the clinician and patient experience means that we can continue to make more improvements based on that. So those are just a couple of things that have stood out for me.
It's really interesting, that point about the positive feedback as well, because it's something we talk to our partners about all the time in healthcare generally, that a lot of the time they're constantly recording complaints, negative feedback. But actually, that positive side of any feedback they're getting is just as important, because that's how they can continue to evolve and, kind of spread that amongst staff as well.
Yeah, absolutely. And criteria 10 on the criteria is all about measuring impact. So it is about gathering that positive data of the impact that you've had. And that might be the reach of the information that you've put out, or how many people have used it. But actually, it goes beyond that. It's about, what difference did it make to that person or that clinician? What was the outcome of that decision or that decision aid that they've used? So in EIDO's case, it might be that person feels really informed about the consent that they've given. They really have understood what they're signing up for. And then that, for the physician, means you're going to have a patient who's better prepared for the surgery, who's going to kind of understand what the likely recovery is. And hopefully for the NHS, that will reduce any litigation, because there'll be less decision regrets, because people will have been fully consented for what they've signed up for. So it's actually capturing those impacts, so we can really demonstrate the difference that health information makes, because it can be profound for people to have the right information at the right time. And I think as we're moving into this, the 10-year plan process, and we have lots of stuff coming through on new digital tools, new types of support for patients, we really need to understand the impact of those changes and what they're bringing to people. So, that measurement of impact and collecting the positive is really important.
I was going to touch on the criteria actually, Sophie, in terms of Julie mentioned it briefly earlier. What is the criteria for the PIF TICK? How do you ensure that organisations that are using that, their content is as it should be?
So we have 10 criteria, and they cover a whole range of subjects around, do you have a process? Do you have trained staff? Is your information evidence-based? Are you using appropriate sources of evidence and communicating them clearly? Do you involve users to make sure you're meeting their needs? There's a range of criteria, particularly around using plain language as well, and using plain numbers, making sure that you're being health literacy friendly and meeting the needs of users. So the criteria are quite detailed, and there are 10 in total, and there are sub-criteria underneath each of them. We create the criteria by working with the steering committee, and they're reviewed every couple of years to make sure that we're really up to date with changes that are happening in health information. So last year we added criteria on AI, because there are lots of potential benefits of using AI in health information, but there are also risks. So we added criteria around how you manage those risks and having a policy if you are going to use AI, and training your staff. So how those work is, people will join PIF TICK, and then they will put, there's an assessment portal, and they will put their evidence that they're meeting the criteria into that portal. And then they will have a meeting, an assessor will review that and maybe send some queries. And then you'll have a meeting together where you'll run through the evidence you've submitted against the criteria. And then we will decide if you've reached an acceptable standard or not, or if you need to go away and do a bit more work. And then you will be awarded the PIF TICK. And once you've been awarded the PIF TICK, you can put that on your information that's been developed using your approved process. So that's fine, and we review that process every year. But to make sure that that process is used and it's fully implemented, we do occasionally do information assessments. So organisations are selected at random for an information assessment. I'm not sure if you've had one, Julie. I think you might. Yeah, we will just request a couple of job bags or pieces of information, and we will just check that criteria has been applied. And so that's the process we go through to maintain the kind of trustworthiness of the PIF TICK and make sure that actually when we are certifying people, that they are meeting the standards we require and that they are actually applying that process and those standards in practice to the information they produce. I think the information assessment is also useful in its own right for people. We've had lots of really good feedback about the information assessment. People were initially like, that sounds scary, you're going to come and really, kind of scrutinise what we're doing. But actually, again, most people have found quite often it's practical tips about how to actually make sure that process is applied in practice, because the important thing about any process is it's really easy for people to follow and apply, because you can have lengthy processes that gather dust on shelves and nobody looks at them. And this is all about being practical, being focused on improvement and being focused on producing the best information that you can. And the other way that we use information assessments is on the rare occasions when we get a complaint. And if we do get a complaint from the member of the public or a clinician, then we will. Sometimes that can also trigger an information assessment. But I'm really pleased to say that so far we haven't had to uphold any complaints when we've done the information assessment. It's quite clear that the process has been applied and that actually the information is credible, it's valid, and it meets our standards.
And I would add to that as well, the criteria, when you first look at it, might seem quite daunting, but actually once you start going through it, it's really just gathering the information that you already have. And for us, it really made us streamline those processes. So we might have been doing everything the right way, but actually being able to evidence it, being able to, simple things like showing your folder management. So the example Dan always gave was, what if you win the lottery tomorrow and then you hand your notice in and you're gone? There's a patient safety risk there, that information is all in your head. And that's great when you're there, but once you're gone, can someone else pick that up straight away and carry on with that work, so that information is never compromised and patient safety is always protected. And the other thing, now that we've been doing it for 5 years, I would say is each year that you go through that assessment process, it gets easier. So the first time you do it, you provide all that evidence and you answer all the questions. And then the online system now is fantastic because it saves all of that information for your next assessment. So of course, they're looking for growth and development. So you shouldn't just tick everything every year to say, yep, we're still doing it the same. But there will be elements of that don't need to change. So it is just a process of identifying the parts of your processes that have changed, why they've changed, what improvement that's made, but also what you're still doing that's the same because that works. And so for us, like I said, every year that we do it, it becomes more and more straightforward. Now that there are so many people that have the PIF TICK, that means there's kind of a wealth of experts available to people. So if you wanted to apply for a PIF TICK and you're a bit nervous, then PIF will be able to, talk you through the process, but also potentially put you in touch with someone that's done it a few times and could give you some tips and advice onto how to get through that process. And then finally, I just wanted to add as well, if you don't pass every criteria, it's not the end of the world. The way that works is that Dan or one of the other assessors will give you really useful, supportive advice and guidelines on how you can meet that criteria. It also doesn't mean an automatic fail. It just means, right, this is where you need to improve. This is the advice we'd give you. Now you go away and work on that, and then we'll review that in 6 months or a year's time. And if anything, it's just going to make things even better for you going forward, and of course for your patients.
Yeah, I think what I'd like to kind of add to that really is that our kind of intention and our ethos is to be robust but supportive. And I think that really comes through in the feedback we get and in the work of our assessment team. We also, with PIF TICK, you also get full membership of the Patient Information Forum, and we provide guidance on all criteria areas, which we update regularly. And we also have a sort of series of expert webinars so people can really learn from each other and share best practice. So there's a lot of support that goes around the scheme. And I think, we're very focused on getting feedback and improving ourselves. We do an annual membership survey, and we have really high recommendation rate, 9 and 10. Just under 100% recommend the scheme, and the same numbers say actually it has improved and streamlined their processes. So although it can seem daunting, I think it does give people a really high quality way of producing health information that's standardized across their organization, that all their team can follow, and that brings benefits for everybody. There's internal benefits as well as the actual benefits of the public and healthcare professionals who are getting great health information, and recognition that the tick on the information as well.
Yeah, and from EIDO's point of view, Julie, Sophie just mentioned about the Patient Information Forum itself. So I know EIDO have been a member of PIF, are a member of PIF, shall I say. What's it like as a journey for EIDO, and why is it so important that you're associated with the forum?
So for us, the information we're producing is for patients, but we send it to clinicians and we send it to trusts, healthcare trusts and individual surgeons or departments. So we really need that insight into what the patients themselves need. And obviously we do work with patient groups and the Patients Association to get that feedback, but we really needed that bridge between us and the patients. And that's what we found the Patient Information Forum to be. We've created some really fantastic contacts and relationships through the forum as well. So as Sophie mentioned, the forum itself, there's an email newsletter that goes out regularly where members can put their questions and share their expertise and advice. We found that to be really helpful. And a recent example of something that is a direct result of our relationship and our membership with PIF is the work that we're doing with the Nottingham University linguistic experts. So previously we'd always worked with the Plain English campaign, who are fantastic, and they set the standards for plain English. They look at the reading aid, they look at the accessibility, and the process that we used to follow was that every single new document added to the library was sent to the Plain English campaign for review, and it would only be put in front of patients and sent to our customers once they'd given us their approval. Now, they actually approached us a year and a half or so ago to say, you don't need to do this anymore. We're really happy with the standard of information you're sending us, and actually the process and the cost of it's not really worth it to you, which we thought was very generous of them to say. They could have kept happily taking our money for many years. So what we do now is we send them occasional documents to review. But what we have done, rather than just take that off of our process, is replace it with a new external review process. And that was through a relationship that we were able to build with the linguists at Nottingham University who are also associated with PIF. So those linguists now review every single new document, and they use an approach called the corpus linguistics approach, whereby they review current use of the English language. So what does a word mean today? And we know the words that you hear some kids saying online on TikTok. I've got a couple of siblings who are teachers, and the language that kids use is just completely different to what I understand today. But it's really important to acknowledge that and say, okay, the information we're putting out, that some of our documents were written 15 plus years ago. Now, of course, we keep them up to date and we clinically review them every year. But are we checking that the language is still appropriate in 2025 to what it was in 2010? So the corpus linguistic experts review that information. They give us feedback. They will say, actually, that word that you've used in this particular document it appears once in a million words within our data. So we found that to be fascinating. As editors, we've all absolutely geeked out over this whole process. And we're really interested in the feedback that comes back every time we send them a document. So for me, that's a really tangible example of how we've been able to further improve our information in a way that we didn't even know was possible, really. We didn't know that was an option until we met Svenja and Emma at Nottingham University through PIF.
Yeah. It's a really interesting point, that actually, the language, because like you said, consent is so important, and the important bit of consent is people understanding what it means. So actually, if there are certain words or anything like that, like you said, 15 years ago made sense, but now to somebody younger that is potentially, about to undergo a procedure, then making sure they are aware of exactly what that means in the language is imperative, really, isn't it?
Yeah, the GMC guidance around shared decision making says that information should be shared with patients in a way that they can understand. So that's really key to what we do, and that's really key to what PIF expects the members of the PIF TIC to do as well. So yeah, it's absolutely essential. And a decision is not informed if the information that's been given to the patient is not accessible to them.
Yeah. Well, we've got to touch on AI, obviously. We mentioned it very, very briefly at the very beginning that we were likely to chat about it. And obviously, we are living in a time where misinformation spreads faster than ever. AI summaries, people Google and things, it's so easy to get misinformed about health. So Sophie, how does the PIF TICK and trusted sources like the PIF TICK help to combat the new world, I guess, that we're living in?
I think it's become increasingly difficult for people to identify what they can trust. So I think having a quality mark that people can see and look for and ask for it has become vitally important. So we did some work with Ipsos last year, and we did a survey of sort of 2,000 UK adults using their knowledge panel, which is makes sure you get a representative sample of the UK population. And what we found from that piece of work was that 1 in 2 people said they struggle to identify what they can find, to find trusted health information now when they're looking at knowing what to trust. And that's been backed up by kind of European health literacy data as well, which shows that 2 key challenges with health literacy now are gaining information from the mass media and making decisions about treatment. So here we are right at the crux here with the stuff we're talking around about consent. So AI is here to stay. It's not going to change. But I think what the issue we see with AI, particularly generative AI, is there's been a kind of race to release products before they are actually ready and safe. And this applies to all sorts of forms of generative AI. So ChatGPT, somebody sent me an awful screenshot from that last week where someone asked a question about eating disorders, and it recommended a 500 calorie a day diet. So really, really unsafe. But also there are issues with Google AI summaries, which we're now seeing coming to the top of our search function. And just because it has the same issues as other generative AI, it's as good as the sources it's scraping. So we've kind of met with Google now to sort of talk about our concerns about that. Because there are inaccuracies and hallucinations and out-of-date sources, and very US-based sources as well, rather than UK-based sources. So I think, now more than ever, we didn't know about AI coming in 2020, really, or the pace of change when we started this. But actually, it has made it really important to have verification of health information. And what we found from the Ipsos data was that 2 in 3 people really wanted verification of health information. They wanted that support now because it is so hard. We also know there's rising awareness of PIF TICK. So that data also showed us that 1 in 10 of younger adults are already aware of PIF TICK. So our mission now is to increase that awareness and encourage people to look for the PIF TICK or ask for the PIF TICK. And we'll be doing some more work on that later this year. So if you are in a hospital setting, you ask, well, is this PIF TICK certified? Or if you are looking online, you'll look for information that carries the PIF TICK because you've got that kind of assurance of trust then. So it is about signposting as well. And we're really pleased to see in the NHS plan that there is a bigger commitment to sort of signposting and working in partnership with different agencies in long-term conditions, for example. But it is really about embedding signposting to trusted sources and making it really visible what is a trusted source, even on platforms of social media and stuff like that. I mean, we think that misinformation kind of started in vaccination, but it's spread to all health topics now. Just look at what's happening with cancer information at the moment. And then we worked with another academic at City University who did an analysis of TikTok videos, and 8 in 10 of those were fake news, contrarian, selling products. But actually these things do start to have an impact, and we've seen that in the Panorama documentary that was released recently.
Yeah, and I'm just going to come to you really quickly on that, because I think the AI bit, obviously one of the key parts of what you do in the content team at EIDO is that human element of the content that you put together. and the importance of that, and then that linking back to being a trusted source and, you know, patients feeling reassured that actually the content that they're seeing is correct.
Yeah, absolutely. We would never replace our content production with AI. There's ways that AI can be integrated, absolutely, and it might be able to produce, you know, a first draft or a skeleton version of something, but we would still stick to our very stringent human process. We've played around with it a little bit, and I have to say, for a full-length EIDO document, it's still nowhere near close enough to even consider. The information is inaccurate. It hallucinates things like risk rates, which are incredibly important to making a decision about a procedure. And it just isn't ready. And I don't know that it ever would be. Like I said, and I think Sophie said, AI is not going away. So I think we have to look to ways where it can be integrated into processes potentially, but we will always have that clinician review. We will always have that editorial, plain English, proofreading, linguistic review that we cannot rely on an AI to do. With the PIF TICK, it's giving that reassurance that a human has been involved, an expert human who knows specifically about that condition or about that procedure, about that area of concern, has been involved in producing that information. And if we handed everything over to AI, we would lose that reassurance. We wouldn't be able to guarantee to patients and clinicians that the information that they're using to make these really important decisions is safe. And PIF have actually produced some AI guidance. So like we said, AI is being used. We know that people that are producing information are using it in different ways. And as long as you're using it safely, that's not necessarily an issue. But it's really important to have those guidelines and to make sure you're following them so that you can keep patients safe and keep that information accurate.
Absolutely. And I think the other point about AI, yes, the patient might be asking the question of AI, but it's when Julie's producing content and the other PIF TICK members are producing content, they're actually engaging with patients about what their needs are and how they want information presented. That doesn't happen with AI either. So it's yes, it's answering the questions that it sees, but it's that missing that human in the loop. And we have seen some good use cases, but they're use cases where it's drawing on a closed model of content. So one charity, for example, spent a considerable amount of time training an AI model to produce plain language summaries of clinical research papers. It took them 6 months, really training it, getting the prompts right to get the output that they wanted, even using that closed mechanism. So I think, you know, it will improve, and it is here to stay, but we have to have guardrails around its use. And generative AI on kind of open sources right now is absolutely not fit for purpose. You know, it hallucinates, it's inaccurate, and also it contains the biases that we, you know, see in you know, from the content that's out there. And that can be, you know, there's an example from Radiotherapy UK, for example, that they have spent for the last couple of years really campaigning to get consent forms changed. So it talks about side effects of radiotherapy on all skin tones. But if you ask a generative AI, it will just talk about redness and white skin tones. So there's that racial bias of inclusion that is inherent in these models. It's inherent out there. And we also see them going to kind of sources like Reddit, which are a bit of a free-for-all, or really old sources and repeating out-of-date information. And also what we're not getting is those good user onward journeys. So if someone's having, you know, someone's got cancer or somebody has got another kind of health condition, they're not getting the old links that they're used to, or they're not seeing them because they come to so far down the page to patient support charities, patient organisations who can provide that other contextual information, that advice and support. And actually we're seeing an impact already in traffic to charity helplines, charity websites, because people are not going beyond the summaries, particularly on a smartphone. So, no, you know, that's concerning as well, because people need that support.
The sources bit. Sorry, Julie, go on.
Sorry. I was just going to add to that. I think it's what is needed is some patient education, and we touched on this at the recent PIF roundtable about AI and misinformation, and we can't stop patients from going to ChatGPT and from going to Google, and we can do what we can to speak to Google and speak to these huge tech organizations, but ultimately our power is limited. But what we can do is educate the general public, like Sophie said, for them to be looking for things like the PIF tick, to be looking for the sources where that information has come from, to be looking for that quality mark, and not just to assume that if you put something into a browser or into an AI generator, the information that comes back is absolutely accurate. And it's very clever at sounding right. It's very reassuring in its tone, in the language that it uses. So for most people, why would they question it? And I think we have a role to play in educating them that there are important humans out there that are doing the work that they need to be seeking out, and not just relying on those generative AI engines.
And the data that we had from Ipsos, and this was before we took last summer. So, but at that point, 1 in 10 people said they'd been impacted by health misinformation. So this is a big problem. And interestingly, that went up to about 1 in 5 for ethnic minority communities. So we're compounding health inequalities already. They're already there with misinformation. And as Julie said, it sounds really reassuring. It does this really good job, quite often using really plain language. So it can sound reassuring. And the problem is, if it doesn't know the answer, it just makes it up. And we've seen loads of examples of those hallucinations. And that, frankly, that's dangerous. That's really dangerous for people. We are working with public libraries in NHS England to signpost people going through libraries to PIF TICK certified information, as people going in and getting upskilled on using digital tools, maybe the NHS app or NHS login. What librarians are finding is that they're building relationship, and they're asking for support to sign for health information. So we've been working as part of this health literacy partnership now to help librarians signpost people to health information. We're doing quite a lot of work on our website at the moment to make that easier for them to use and to find the appropriate sources. But I think particularly when people are struggling maybe to access health services or GP services, and they're really keen to get advice, if you're waiting, you're going to go to Dr. Google, or you're going to go and look on these tools. And that those user journeys that were so good before have become a bit compromised, because you're getting these summaries before the actual listings of useful links. And when we did our Ipsos data last year, we found that search engines are trusted at the moment. So, 50-odd% of people said they'd go to the NHS website. 50-odd% of people said they would use search engines. Well, we know which one is the most popular. And that compared to trust ratings of below 10% for national news media and social media. So the concern with the summaries is there kind of misinformation potentially being served up in a very trusted environment. So people are less likely to question. So I think there is a massive public education piece we need to do around AI. But I think it's just such a rapid change that we are adopting these tools without really thinking through the implications at the moment. Doesn't mean to say that they can't be useful in the future.
And I think the important bit in all of that, in what you've both said, is the sources bit, because like you said, you can't stop people using them. They are they're going to be around forever. They're going to get better and better. But actually understanding where that information has actually come from and actually taking notice of the source is then when you can understand the trusted side of it and things like that. So I think the awareness piece around understanding where it's come from and where it's scraped that potential information from is something that everybody could start implementing and taking notice of more.
And on that point about sources, that's within the PIF TICK criteria as well. So anyone producing patient information that displays a PIF TICK has to have got any of that kind of, statistical information or research, has to have come from a credible source. And PIF also have some guidance on what those sources are, what types of sources you should be using. That's really helpful. We have that saved in our useful documents folder. And there's people who are now able to have the PIF TICK who are social media. So there are lots of clinicians. You'll see lots of doctors now on TikTok and LinkedIn and Instagram. And I think that was a really fantastic move by PIF to offer that to those people, because again, like Sophie said, the quality of healthcare information on these social media platforms is dire. So for there to be the opportunity to actually qualify that within a PIF TICK criteria it's essential. It shouldn't be optional. And if we can grow the PIF TICK awareness, and that means that people who are consuming that information can then be looking for it on their social media as well. So if they're following a TikTok doctor who's giving them all these great hacks and tips, they can say, right, have you got a PIF TICK? If you haven't, I'm not going to follow your content.
And that's a really important point as well, because there are lots of doctors out there on social media, and not all of them are doctors. Some of them are doctors, but they have very contrarian views. They might be offering different things. So just because someone's got a doctor doesn't mean say you can trust them, or the information they're producing is really fully evidence-based. So if a doctor or another healthcare professional is with a social media channel, you can tell then that if they've gone through that extra process of PIF TICK, that they are actually showing you that they are going through kind of best evidence-based information that they're providing. And that's really important.
I think it's 100%, and it's the patient, patients getting that information, patients being able to sort of almost digest what they're being told and things like that as well. To know that it's from a trusted source is absolutely vital in then kind of how they decide to move forward with whatever procedure or anything that they're doing. We've touched slightly on that accessibility side, and whether it's location, language, literacy, disability, how important is getting that information, making that accessible to everybody when it comes to consent.
It's vital.
Yeah, I was going to say it's not consent if it's not properly informed. So again, going back to that GMC guidance, sharing it in a way that they can understand. Information that's relevant specifically to that patient. And if you're not able to provide that, it's not informed. Now, we always say an EIDO leaflet is just kind of a brick in the wall of consent, right? So that one-to-one conversation with your clinician, the relationships, speaking to your family and your friends, the decision-making process, there's lots of different parts to it. But the part that we play is in that information. So for us, and for the PIF TICK criteria, accessibility it's non-negotiable, really. So we're able to offer things like we've talked about, that plain English. We're all trained in plain English in my content team. We use inclusive language. Again, that's something that we've built on since getting the PIF TICK. So PIF TICK talks about inclusive language. We have translations as well. We have easy reads. With the digital versions of the information, we're able to offer things like dyslexia-friendly screens and easy reads, screen readers, and changing the font size, choosing your language. Always being aware that not everyone is digital, and despite there is this massive push to digital, and there are many benefits that offers, and we're hopeful that the NHS is going to be able to, through their 10-year plan, provide the education and the tools for patients to be able to be more digitally educated, but also always being able to offer a PDF, a printout, something that the patient is able to access in the way that they choose. So the patient can say, can you email me that, or can you print it off? It's really important. And yeah, I can't say it enough. If they cannot access it, it is not informed consent. So it has to be accessible.
Yeah, and I just think that it's important to remember actually how low skill levels are in the general population. So 1 in 4 people has very low numeracy, sort of at or below level 1 on the OECD data that was released in December. So really up-to-date figures. And it's about 1 in 5 for literacy at or below level 1. So we are talking about very low levels of literacy in some parts of the population, and numeracy in particular. When you're talking about making a decision, we're talking about risk and benefit information. That can be really hard for people to decipher. Even things like percentages can be really difficult for people to understand. So we've talked a lot about plain English today, and that's absolutely vital. And we recommend the maximum reading age of 9 to 11 for health information because of the literacy levels. But actually the numeracy is really important to think about too, and how you express that risk and benefit information that people need to know, like what are the chances of, this being a success, this procedure, what are the chances of something going wrong? People really need to be able to get that data in a way they understand. So we do also have a lot of criteria, and I know EIDO have also done a lot of work on this, on making the numbers really understandable for people, because the numbers, if you say to somebody, oh, it's a rare complication rate, that means different things to different people. In fact, generally people really overestimate when you say what's rare or unlikely. So it's really important we provide that data in context as well and make it accessible to everyone.
Yeah, and something we're working on at the moment as well is the framing of a complication. So for us, the particular focus around if there's a risk of death. So for most, if not all procedures, there is a risk of death, and that will vary. And, thankfully for most procedures, it's fairly low, but it's important that it's framed in a way that the patient is given it completely neutrally. So they're not either scared off by it, but also they're not unnecessarily overly reassured. So we would say the risk of death for this procedure is 1 in 100. That means 99 out of 100 people that have this procedure won't die. So then you've got both frames, rather than just saying it's 1 in 100. Okay, for some people 1 in 100 is quite high, whereas for someone else they might think, oh, for considering my quality of life currently, I would take that risk in order to improve it. So that's been a really important step that we've taken, so that again we're giving the patient full power to be fully informed about that decision.
Yeah, that's really important. Really important.
100%. And I think that's where things like the PIF TICK obviously supports that process of informed consent when it's, in a clinical or surgical setting as well.
Yeah. We work in the medico-legal space, really, ultimately. So at EIDO, we often get requests from surgeons or from trusts for an archived version of one of our patient information leaflets, because there has been a question or a complaint from a patient around failure to inform. And to date, the information has never been used against a clinician. It's always been able to support clinicians for them to be able to demonstrate that the information they provided was as accurate as it could have been at the time. When it comes to surgical consent, getting that right couldn't be more important. And we had a case recently, last year, of 2 clinicians who had a complaint against them about some procedures that a woman had to undergo for urology. One of the complaints, again, was that she felt she hadn't been given the opportunity to give fully informed consent. And of the 2 surgeons, one of them had used the EIDO library and one hadn't. And the one who had used the EIDO library, the judge used the words, the recognised gold standard of information was given to the patient. And actually that surgeon's case was dropped and dismissed. So for us, getting that information right for surgical consent, it couldn't be more important.
Yeah, and I mean, that's protecting the clinicians as well. But I think, thinking about a person going through that surgery, and it's really important to know what you're signing up for, and so that you make the right decision for you and your family, because as Judy says, we've all got attitudes to risks. 1 in 100 might be too much for somebody in their circumstances, but it might be fine for someone else. But unless you've got those numbers, you can't make the right decision and give informed consent for you in your personal circumstances at that time. And I think it's really encouraging that, and I think I'm still right in saying this, Julie, that in Wales, that the EIDO library is mandated by the kind of risk organisation, because it's gold. It is, as Julie said, it's gold standard information. It's accessible to people. It's evidence based. And also there's something they can take away and reflect on, because when you give information to people verbally, they don't retain it. Particularly if they're in a stressful clinical environment, there's so much data which shows that actually people walk out and they don't retain that information. So it's very, very important for patients and for professionals, for their own protection, that actually they're using the best quality standard of information that they possibly can, and that people are able to use it, understand it, and then actually make that informed decision. That's really important, and give that consent.
Yeah, and you're right, Sophie. In Wales, it's mandated if there is an EIDO leaflet available. and it wasn't used, and there is a complaint about failure to inform, that clinician or that health board will not be supported by the Welsh Risk Pool. So again, that just demonstrates the NHS Wales recognises the gold standard information that we're producing, and the PIF tick is absolutely an integral part of that process.
And I think what's unfortunate is it's a postcode lottery in lots of parts of the country about the type of information that you get. And that's not really acceptable in a national health service, I don't think. So some organisations will produce great information, but others don't. And people are not properly consented, or don't have that proper kind of information to support that consent. And it just seems a waste of resource to me as well, that if there's a great information pool there, there should be consistency. It's a national service. It should be more of a national consistent standard, even if it's not an EIDO leaflet, but it's meeting those same standards wherever you are in the NHS. We should be having consistent, standardized information and care. I think it does. Maybe it's produced by somebody else potentially, but actually it should meet the same standards, and people should get that same experience. Why reinvent the wheel? How many leaflets are there in the library now, Julie? There's
435, I believe, plus all the translations and easy reads and everything else. Yeah, exactly that. And I'd actually noted down in preparation for this podcast that healthcare professionals, not only should they be looking for the PIF tick, but if they're producing information themselves, they should be applying for the PIF tick. Now, obviously, for EIDO, it would be fantastic if everyone took up the EIDO library. We would love that. But the NHS doesn't currently operate like that. So it is a postcode lottery. But there is really fantastic information out there that isn't produced by EIDO. I will put my hands up and say that quite happily. But if it's not going through the PIF tick, there's not that reassurance. There's not that guarantee to patients that information is safe. And there'll be some extremely busy clinicians that have produced really good information, but the thought of them having to then review that and update it and make sure that any new evidence has then been included is very overwhelming for them. And, in an increasingly busy and overstretched NHS, that's a really difficult thing. I wouldn't, expect any clinician to have the amount of time needed to do that. So from our perspective, we have a whole team that do that. That's our day-to-day job. So we're always encouraging healthcare professionals to come to us and say, look, I really need this procedure to be able to give to my patients. Okay, great, let's produce it for you. Quite often they'll regret telling me they want it, because I'll go back to them and say, can you write the first draft, please? But yeah, I think like Sophie said, it is currently a postcode lottery, and it would be really great if we could see more standardization, or, a mandate from NHS or from government to say, if you're giving information to patients that's going to support a decision, it's got to be PIF ticked.
Yeah, and there are organisations that are PIF ticked. So the first and longest organisation that has been PIF ticked in the NHS is Guy's and St Thomas's, and they have an amazing information team. And what they do really, really well is meet the specific needs of their community as well as signposting elsewhere. And that's where you can have that kind of strength for those local information services. So there is really good practice within the NHS, but it's not everywhere. And that's the concern. We need more standardisation of what people experience.
Yeah, absolutely. I mean, the vast majority of our authors and reviewers are in the NHS, and they are really committed individuals that are passionate about getting that information right. So I completely agree with you on that, Sophie. The work is there, it's being done, but it's just standardising it.
And that's in part of our kind of response to the NHS plan, was that we need to have a consistent mandated standard for health information across the NHS. And it really does need to focus on that accessibility, because I think that's one of the things that clinicians struggle with, is to write sometimes in plain English, because that's not what they've been trained to do. They've been trained to write in a kind of very clinical way, using a lot of medical jargon. I mean, the NHS is full of jargon as well. So it's actually, when you try to break that down and put it into plainer English, that's a skill in itself. And if people, it's very difficult for you as a clinician to realise what people don't understand. And the longer you write health information, the more you get kind of embroiled in that language, and realise that your language has become much more expert, and you have to keep a check on it. I have, when I was writing health information myself, I had to check myself all the time because I appreciated my level of understanding had changed. So, it's hard for clinicians to suddenly drop the whole lexicon that they have in their heads and think about how to write in plain language.
Yeah.
I always say to our authors when we're commissioning a new document, don't worry about it being plain English. Just get the clinical side right.
Yeah.
Get this, the research right. We are here, we're trained to do the plain English bit for you. And, we get a variety of standards of that kind of information being written, but we're always very open to say, we don't expect you to be plain English trained. That's not your job. That is absolutely our job. And you're right, Sophie, you can also doing it all day, every day, you can get lost a little bit in it yourself and forget that certain terms that we might use conversationally on a Teams call with my editors wouldn't be recognised by other people. So we use a lay person who reviews all of our documents, who doesn't work in healthcare, doesn't have a healthcare background at all, and she proofreads the information and she'll come back and say, I don't know what that word means actually, or that sentence doesn't quite make sense to me, or that bit made me a bit nervous. And that's really helpful for us as well, to have someone who's completely removed, not just from EIDO, but from healthcare, absolutely nothing to do with healthcare, that can give us their input and their feedback.
Yeah, that user test is really important, and is part of the PIF TICK, but also so too is clinical review. So, clinicians are an absolutely vital part of making sure that the information is correct, and, it represents the evidence, but it also represents what's likely to happen in an NHS service and what people can expect in an NHS service, because there's one thing to have the evidence, but it's also that day-to-day kind of practical experience of what people can expect.
Yeah, definitely. So how can we get more healthcare organisations encouraged to adopt the PIF TICK? We've talked about it would be great to have standardisation, but in the event that we don't have that at the moment, how do you think we can raise the awareness, encourage more people to adopt this, the trustworthy source of the PIF TICK?
From our point of view, we've had endorsements from the World Health Organization, from the Academy of Medical Royal Colleges, from the NHS. So there's a lot of recognition behind the scheme. And I think it's almost getting to the point now where there's such a critical mass of organisations that have the PIF TICK that you have to question why somebody wouldn't. And I think that's a really important part of public actually asking for and looking for PIF TICK information, that actually you're demonstrating to people that your information is up to date, it's relevant, it's accessible, it's evidence-based, and we know that people want that. So it's kind of it's fulfilling a need that the public have asked for. I think the other piece is also just all the stuff that Julie said earlier, that actually it makes life easier for you as an information producer, because your processes become more streamlined, they become easier to use and implement, but you're also part of this amazing community of practice of health information producers. So we keep the fees on a non-profit basis. They are, really reasonable, particularly for small organisations. So I think it is just about making sure that we just keep promoting the scheme and making sure that people understand the benefits, not just for the public, but for themselves as information producers, a big part of it.
Definitely.
Yeah.
And I think that is such a good way to kind of finish off what we were chatting about. I know we could talk for hours about this stuff, and it's just so important. I think, some of the things that you both mentioned towards the end there were about that, the information, people understanding it. I've got examples of people who have had diagnosis and other things, and almost like the clinicians they're in that world. They will say these things however many times a day. They're so used to just telling somebody something. And the stuff I've heard is actually people walking away and going, I have no idea what they've just said to me, because I'm trying to take in what they're actually saying, but also then what the options are. So to have that information in plain English, to understand it, to kind of feel like then you're making the right decision as well. And to share that with family, friends, that shared decision making, I think is absolutely fundamental in then knowing you're doing the right thing for you as well. We touched on that, everybody's individual. So yeah, I think there's a lot of stuff in that we've chatted about that a lot of people can take away from this episode. So I'm going to end it as we always end it, and ask you both about your What the Health Tech moment. So at the end of every episode, we ask our guests to share something that has impacted them in some way. So we've had weird, wonderful, funny, emotional. We've had a bit of everything, I think, over the last few years with the podcast. So Julie, I'm going to come to you first to ask you what your What the HealthTech moment is.
So for me, it's what I call EIDO in the wild. So obviously I work in the EIDO world every day. But it's when people have spoken to me and said, oh, I had an operation recently, or I was suggested an operation and I was given your EIDO leaflet and it really helped me to make a decision. We don't always have direct contact with patients that receive our information because of the way that we provide it directly to the healthcare trusts. So yeah, for me, it's really that kind of affirming we're doing something that makes a difference and we're doing something that helps people in a really difficult time. And it always takes me by surprise, but yeah, it's always a really lovely, special moment. I always quickly go and tell all my team very proudly because they all work very hard behind the scenes on the information. So yeah, that would be it for me.
I love that. And Sophie, what about you? What's your What the HealthTech moment?
Julie's was so positive. I'm going to do something less positive. And Julie's spoken about the impact of good health information. I'm going to talk about the absence. So I was working Kidney Care UK, one of our members, so a round table recently, and a person was giving their story about their chronic kidney disease diagnosis, and it had actually come through the NHS app without any contextual information. So that's not okay, because then that person was thinking, well, I don't know what stage 4 kidney disease means. So then they're trying to phone their GP. They can't get an appointment to explain that. Then they're left Googling. So it's about health tech. Yes, it's great to have those results coming through the NHS app. We're about to see this huge expansion of it. If that person had been at that point given a link to Kidney Care UK, they could have contacted their advice line and got some immediate support and got some information and some context around that, which would have taken pressure off the GP as well. So I think it's when we're thinking about designing new tech, we really need to involve people and make sure that it meets their needs, because actually getting a result like that, which sounds very frightening without any context, is not very helpful for somebody's health and well-being, and can then potentially push more pressure back onto services because people are trying to find out why. So I think my What the HealthTech moment is design that service around people, design the tech around people, and make sure that you're not causing another problem, to make sure that if you're giving that information, there's some, a test result, a diagnosis, that there's the information and support and signposting to a good information source to support them.
What's really interesting about that is we actually did a podcast a little while ago, and it was about people first, tech second, because the tech's there to support, to do a lot of amazing stuff, but actually the processes, everything else should be designed around people first. And I think that is a prime example of understand how that person's going to feel getting that and what else would they need, and then design the tech to fit that.
Absolutely. And I think we've all used tech that doesn't meet our needs, and we'll maybe download an app once, doesn't meet our needs, we'll never use it again. Or if it's clunky or difficult, then we'll just think, oh, I'm not using that. And I think we did some work last year with the Health Foundation where we looked at patient portals, and there were a lot of portals that had been downloaded but used once or twice, and then people don't persist with them. So these things will only deliver the benefits if they're designed around people and they make people's lives easier fundamentally.
Of course. And I think that's the perfect end. Let's make people's lives easier. 100%. So that definitely brings us to the end of today's episode. I want to thank you both for sharing such valuable insights into the importance of trusted health information, the role of the PIF TICK, and how organisations like EIDO Healthcare are setting the gold standard in patient communication. I think in a world where misinformation is just a click away, it's reassuring to know that there are systems and people working to ensure that patients receive clear, accurate and accessible information, especially when it comes to giving informed consent. So yeah, thank you both for sharing your thoughts, and I'm sure there is so much that people can take away from this episode. Thank you to everybody for listening. Join us next time for another new episode. Don't forget to rate and subscribe. And if you've got any questions for Julie or Sophie, please email us at whatthehealthtech@radarhealthcare.com.